Hello everyone, I'm Dr. Rohan Khandelwal. I'm a breast cancer surgeon and a surgery faculty. I'm making this video on special demand by a lot of students who've secured a good rank and have got a surgery residency after the NEET PG exam. Now, their surgery residency is going to start on May 1st, and all of them have been messaging me how to approach the first year. So this is just a short video to address some of those issues. Now, firstly, I would like to congratulate all of you for securing a good rank and getting this surgery PG. The first thing before I tell you about your preparation and what you need to do in the first year, I want you to guide your juniors. Now, that is a responsibility which you have. As your seniors have guided you, you should guide your juniors as well through this tough phase when they are preparing for the entrance exams. Now, in the first year of post-graduation, the first month or so is a transitional phase. Over the last 1 year, you've been so engrossed in your books, you've just been studying, you've done very little physical activity, and you've had hardly any patient contact. So the first month is going to be that transitional phase when you're getting used to the system, you start getting used to the long working hours because you're starting off as the junior most. So when you start your surgical residency, my first advice to you would be don't shy away from hard work. It's very important to work hard and to gain the trust of your seniors. Because unlike medicine, surgery is a branch where your seniors would only give you work and only give you surgeries or teach you surgeries and skills when they know that you can be trusted. So first thing, don't shy away from hard work at all. Spend more time in the ward, take care of the patients, get to know the staff, get to know the sisters whom you're going to work with over the next 3 years, get to know your seniors, your senior postgraduates, your senior residents, your consultants. Then the most important thing is patient care, right? Talk to the patient. Get to know their problems, right? Don't just look at them superficially. As I always say, the first year postgraduate is the most important person in the surgery ward because you are the one who's seeing the entire picture. And when you give rounds to your seniors, you are the one who's going to convey that picture to your seniors. And you're going to tell your seniors a trailer. So unless your knowledge of the picture is good, you can't give them a good trailer, right? So spend time with the patients, do their dressings yourself, take their vitals yourself. All these are very important habits which you need to inculcate right from the front. Now, with regards to skills, surgical skills. So surgical skills are learned over a period of time. You can't learn them overnight. And you certainly can't learn them just by watching a few videos. Okay, so when you go to the ward or when you have your free time, ask your seniors to teach you knots. Right, these are the basic things which you should know. Get a few suture packets from the ward or the theatre and practice these knots whenever you get a time. Similarly, practice basic skills if you haven't done them previously. Basic skills of chest tube insertion, Foley's insertion, Ryle's tube insertion, all these things, venous cut downs. These are certain emergency procedures which all of you should know. And in the next few months, you should master these skills. Now, although it is important to work in the ward and to spend time in the ward, you should also do some bit of reading. Again, I would say that more importantly, focus on the skills right now, but do read whenever you get a chance. The books which you can read, the first book which I highly recommend is Pye's Surgical Handicraft. This is a book which tells you about basic ward care, about the fluid therapy which you need to give in a patient. So you can utilize this book to get to know the basics. Okay. In addition to that, I would recommend that you revise the notes which you've made for your preparation and supplement it with Bailey. You need to read Bailey, that is very important. And this is probably the best time to read Bailey. In addition to that, you can choose either Sebastian or Schwartz. Both are good books. There are certain topics which are good in Sebastian and certain which are good in Schwartz. But I wouldn't recommend that you buy both of them. Buy one of them, and the topics which are good in the other one, you can always get a photostat done or borrow it from your friends and read that. Get one surgical atlas, right? These surgical atlases help you understand the surgical procedures. I used to follow Zollinger's surgical atlas. There are many others in the market as well which you can use. Similarly, a surgical anatomy book. There is a book by Skandalakis, there is McGregor's Surgical Anatomy, or you can use Snell's. So any one surgical anatomy book. Now, as first years, most of your work would be pertaining to GI surgery. So a very good book to have is Main Goes Abdominal Surgery. Now, this book is such a nice book to read. You can read it like a storybook, and you'll understand the surgeries really well. If you're interested in urology, you can go for Campbell. Otherwise, Smith is a good book to learn the basics of urology and follow that. So these would be the books which I would recommend that you refer to during your first year. And if you see a case in the ward that day which you don't know about, I would recommend that when you get to your room that night or when you're having your dinner, go through that case from the book, so that next day when you're taking rounds and when your seniors ask you questions, you can easily tell the answers to them. A lot of students have also messaged me regarding MRCS. Well, I would not recommend that you take the exam in the first year. Build your basics, read Bailey, and towards the starting of your second year, you can take Part A of MRCS. Part A of MRCS, you need Bailey. You need to read a book called Raftery. So Bailey, Raftery, and Maheshwari for orthopedics. If you can do this much, that is more than enough for your Part A of MRCS. Okay. Part B is a practical exam, which I usually recommend towards the end of third year or when you start your senior residency. Okay. So again, before I end, I would again like to say that surgery is a great branch, but don't shy away from hard work and gain the trust of your patients and seniors. Only when you do that will they give you work in the ward and work in the theatre. Okay? And don't forget to guide your juniors as well. All the best. If you have any questions, feel free to put them in the comment section below, and do subscribe to my channel by pressing the bell icon. Thank you.